Well, good evening, everyone. Welcome to our second in the series, the workshop series on preparing you for the MMI, for the multiple mini interview. And it's good to have everyone in the room tonight. And I hope that all of you have had a good day. We're going to give a few minutes for others to join us while we're waiting. Why don't you type into the comments bar where you're from, where you're watching from tonight. A little bit. Hello, everybody. A little bit about. I always like to know a little bit about where everybody's from and where we're having our viewers from. So let me know. But we'll get started here briefly as we get everyone settled in the room. It's going to be a great night. We're going to really have a nice time together and enjoy. We have Las Vegas, Southern California, Langley, Virginia, Lake Worth, Florida, but originally from Kansas City, the city of fountains, Michigan, North Carolina, all over the place. Watching you from Toronto, Canada. That's wonderful. Here's a fellow Texan from San Antonio. I'm in Austin, Texas, the wonderful place of Central Texas, along with San Antonio's, not but hop, skip, and a jump down I-35. We have Charlotte, North Carolina, Los Angeles, Keller, Texas. That's up in the Fort Worth area of Texas. So it's really nice to see everyone coming in from virtually all around the country. Provo, Utah, wonderful country up in I think Provo's in kind of central northern Utah. Not sure about that, but Birmingham, Alabama. Nice to see you, Micah, in the room tonight. Here's Catherine's from Ohio. So this is great. We're looking forward to spending a little bit of time together tonight and talking about how to ace your MMI. I think this will be applicable to other types of interview settings as well, so we're all in this together. I'm certainly not an expert on medical ethics, but I have a little bit of a background and have facilitated on the medical school level ethics workshops as well as applied ethics cases for medical students. And so we'll look at these together tonight. We've got a couple of cases we're going to look at and hear what you guys want to talk about and see how you might respond to some of these questions, some of these ethical dilemmas. So we'll get started now. So this is a 4-part workshop on ethics in preparation for your interviews, in particular the MMI, but as I said, others as well. And I wanted to just remind you a little bit about some of the types of interviews that are what MMI is all about. It's multiple mini interviews. It's a series of short interviews, interview stations, typically somewhere between 6 and 10 stations, where you will be presented with a scenario of some type, and you'll be given a couple of minutes to collect your thoughts about that station. Then you'll enter into the room, whether it's in reality, in a physical location and room, or in our reality right now in the pandemic of COVID, the virtual room, and you'll be given usually around 8 minutes to respond to the scenario for the interviewer that is there. These interviews, the multiple mini interview, are really meant to assess personal qualities or personal skills that you might have, such as oral communication. Can you communicate with me in an appropriate way, in an understandable way? Communication, whether it's verbal or whether it's also nonverbal type communication can be important, such as looking your patient or the interviewer in the eyes is a good example. Eye contact, as well as other types of nonverbal communication. They're looking at your critical thinking skills, your thought processes. How do these work, and can you sort of think on your feet and really respond to a question in a short period of time? Self-awareness, aptitude for the situation at hand. What is going on, and what might my responses be to that particular scenario. When we're looking at MMI, there are a whole lot of angles to the ethical issues that might be presented. And I talked about this last week. There are medical issues involved. There are often legal issues, financial ones, social ones, institutional policy type issues that have to be considered within the context of what the scenario might be. And so one of the things I value about this type of workshop is that we are able to really talk about with each other and look at what are these different angles, what are these different perspectives that we might want to be considering in the process of delineating what this case might be. And I wanted to also remind you, and we're going to use this ethical framework in a little bit tonight, but next week, in the next 2 weeks, we'll have lengthier cases with a lot more detail than the sort of vignettes that I presented last week and two that we're going to do tonight. But in the framework of ethical decision making, there's these 4 steps that I think I really want you to connect with. And if you can connect with this framework, then in your process of thinking about a scenario that's presented to you, as well as responding to it, this will help you organize yourself. So the first is you identify what are the problem, what's the issue, what is the primary focal issue at hand, or in other words, what's the dilemma, what is the ethical dilemma that's being presented to you. Secondly, you need to understand that there are things that you know and there are things that you don't know, and being able to identify what are the things that I know and what are the things that I don't know. And then you delineate the various options that are available to you in order to resolve the ethical dilemma. Finally, you're going to choose the optimal one and answer the question at hand and respond to the scenario. Sometimes they will present you with an acting one, for example, an acting scenario where you'll be asked to act something, act out with the interviewer, who will be the other person in this acting. And so a good example of what you might find in terms of that acting would be something like this. You're a third-year medical student doing your rotation in OB-GYN, and you notice that a fellow classmate, we'll call him Michael, often shows up late or slightly hungover. One day you find him in the break room alone, and you decide to talk to Michael about this. So please enter the break room, and talk to Michael. So in that type of scenario, an acting scenario like that, you would be asked to go in to the room and act as if you are indeed this OB-GYN, this medical student on the OB-GYN residence, on the OB-GYN rotation, and you're going to be talking to your friend Michael, your classmate Michael. So you have to do a little bit of acting there, and really it's slightly awkward, but you do have to do a little bit of acting in that regard to make it to play that out. There are also non-acting scenarios that you might be presented with. A good example of that would be you discover that your best friend in medical school has cheated on an assignment. What are you going to do? So in this type of scenario, you're not asked to act it out, but you're asked simply, what would you do in this particular situation? There might also be character questions that will be asked of you, and a very good example of this is one that comes up not unusually in a medical school interview, and that would be, what is your greatest weakness? So they're not asking you to, it's not a scenario they're giving you, but they're giving you simply a question for you to respond to about yourself. In this case, what is your greatest weakness? Or, for example, another example might be, describe a time when you needed to ask for help. Describe a time when you needed to ask for help. So you're responding out of your own character, out of your own personality about yourself in reality. So those are some examples of types of MMI questions that you might get. We're focusing, of course, in this workshop series on those on ethical dilemmas that are presented, that are being presented. So what we want to do now is jump right into a couple of scenarios, and I want to hear from you guys what you think about this, and I want you to respond in the comments so that we can talk about these this scenario. So scenario number one, let's look at that. So I'll read it to you, and hopefully you can see that on the screen pretty well. Ethical scenario, number one. A 21-year-old man has a seizure and stops breathing in his home. The EMS team intubates him and rushes him to the nearest emergency room. A CT scan of his head shows a large mass that has eroded through the cranium into his brain. A biopsy of the lesion shows the tumor to be a malignant one. The oncology team believes that neither radiation or chemotherapy will be of any benefit. The neurosurgeon does not think removal of the tumor is warranted because substantial portions of the patient's right hemisphere will have to be removed. Moreover, the patient will not likely recover any cognitive function and will not survive. The family, however, insists that surgery be done to remove the tumor because a small, quote, a small chance is better than no chance, end quote. So the question here that may well be presented in an interview setting is, what would you do? Would you do the surgery? So what I'd like to hear from you in the chat is kind of thoughts that you have about what are the issues here that we need to be considering. What are those that we really should think about? And this is a really good and not an unusual type of scenario. It's certainly real world type of stuff. So the answers, could be varied. Yes, obviously, or no. Or you might respond, well, it sort of depends on a variety of different issues, which I'd like to be, hear kind of what you think those variety of things might be. John, I'm not sure where John is from. John says, that's hard. Yeah, these are hard things, right? So one of the issues, what are the issues here that we want to really think about in this particular scenario? So Emily says, your job is to present the facts to the patient and guide them through this decision. As someone whose family member underwent cancer treatments, I see both sides. Makes sense. John says, does the patient have instructions? In other words, is there a directive here, a living will of some sort, or some sort of legal documents that will help guide this decision-making process? Good. That's a good question. Not really presented here in the scenario, so we don't know the answer to that question. Trish says he is 21. He is an adult and can make his own decisions. Trish, insofar as that's true, Trish says, ask the patient what he wants. Muhammad says, acknowledge the difficulty in this situation, express the information in an empathetic way, and allow the autonomy of the patient and their family. This is a good response, Mohammed. Thank you for that, because this is a key term in medical ethics, and that is the issue of autonomy. Our Western society is really built on individual autonomy. Now, Mohammed is expressing that in terms of the patient autonomy, as well as the issue of the family as the sort of an extension of that autonomy. So, very good point, Mohammed, in terms of letting the patient and the family make a decision about what they think should be happening. Purva says one of the issues is that it's the families making a decision rather than the patient. Good point. So where we have here potential conflict between what the patient wants and what the family may desire. And that could very well be playing out. We don't know. We're assuming that the patient is communicative, but we don't know that. He may not be. If he's not communicative, then you're really dependent solely on the family and on the family's directives and desires. Bursa, I think it's Bursa or Burse, says, personally, I do not think I would do the surgery, even if he survived. What is his quality of life after the surgery? The family will need to be supported and maybe counseling or case manager involved. Good. That's a good point. Very good point. We have from Langley, Virginia. I don't know the person's name. Says, I would proceed with the surgery because I'm young and do not know the outcome for such scenarios at this time. Best case scenario, the surgery goes well and I gain experience. Good point. If you're a well-respected neurosurgeon, however, and with years of experience, then you may not need that. John says, could you potentially consult the ethics board in terms of, you may not have time for that. Ethics boards typically deal with bigger issues where there's timeliness is not necessarily involved. Perhaps transplantation type issues, for example, would be maybe somewhat common, but you may not have that benefit here. So I have maybe a couple of questions that we could expand this to. One of my questions is, are physicians obligated to follow a patient or a family's wishes when the physician sees little or no chance of recovery? So what is the obligation of the physician in a case like this? Should you as an individual physician feel obligated to do this surgery if the family desires that you do it? Or would that force the family to find another neurosurgeon, perhaps even transfer the patient to a different hospital in order to have their wishes be met? Are physicians obligated to follow a patient or a family's wishes when the physician knows that the intervention is more likely to cause death than to provide any benefit? In other words, again, what is the obligation of the physician if there's no chance of recovery or very little chance of recovery, or if it is potentially likely to cause the death by doing the surgery? Non-maleficence is another term that we talk about in ethics, which is essentially, we don't want to do harm. We don't want to do anything that would harm the patient. Would this, in fact, be doing that? Right. Emily says again, do no harm. Here's another question: is this small chance really better than no chance at all mentality? Is that a good mentality when the cost to the patient physically is so high? The cost could be devastating in terms of his own cognitive abilities, perhaps even his ability to sustain his own life. What about that? What is the cost to the patient in a scenario like this? Pam says, if you feel that the risks outweigh the benefits, I don't feel that there's an obligation to go along with what the patient or family wants. And again, Kanza points out what is the quality of, even if the patient survives, what is their quality of life going to look like with a good deal of their brain removed? Here's another question: Is a small chance really better than no chance at all? This mentality appropriate when the cost to the healthcare system is so high? Now, this is something that I think frequently students are hesitant to consider. But when we consider this, we have to consider that there is a cost involved. There's monetary cost involved for the hospital, for the doctor, for the anesthesiologist, and other professionals that would be dealing with this situation, for the hospital itself in terms of the effort put forth in terms of the ICU after the surgery. There would be a cost involved in time of reservation of a particular surgical suite. Can the hospital devote a surgical suite to a situation like this where there may be very limited opportunity? And then, what is the cost to the healthcare system? Does the answer change if this family can pay out of pocket for the brain surgery? Let's say, for example, that this is a wealthy family, and their cost isn't an issue for them in terms of paying for whatever would be necessary. What if this family is destitute? What if they're a very poor family? And who's going to pay for this surgery? They want the surgery done for this a small chance is better than no chance at all mentality. Do we consider costs, the financial part of the picture? Is that to be a consideration or not in terms of a resolution of this type of case? So what do you think about that? Do we talk about money in this case? Now, certainly the neurosurgeon has to consider that there are costs involved. There's physical costs to the patient. There's emotional cost to the family. There is financial cost to the hospital, to the institution, to the healthcare system in general. That can't be overlooked necessarily. Trish again says, I think explaining to the family and the patient that even after the surgery is done and is successful, the patient will not have a fulfilled life. But as a doctor, I have to listen to the patient or whoever has the power of attorney to make that decision. If I do not believe the patient will make it, I would refuse to do the surgery. All right. Trish is pretty set on that. That sounds good. Kanza, again, regardless of their wealth, it is important to look at the situation as a whole. Right. And this is that framework we talked about. What are all the issues here that have to be considered in terms of this situation? And maybe it depends. Maybe the physician really has to, in some way or another, gauge the situation. So, for example, if the family seems really set and unwavering on this decision, then it might be prudent to go along with their wishes. A lawsuit certainly wouldn't benefit the situation at all, and would benefit anyone involved if that came to be a reality. So, also, if the physician really feels that the family's not not set on this decision, then they may want to spend more time counseling the family in hopes maybe of persuading them to see the futility of the case, at least in the estimation of the surgeon. It really does depend sometimes on the family dynamics that are going on here in terms of what the physician might do in this particular case. So it may well depend. We have a comment here. Are there right and wrong answers to these ethical questions? Or are the interviewers just hoping to hear the candidate thought process? Yeah, as we covered earlier, absolutely. You don't go into these ethical scenarios thinking, oh, I got to get the right answer. What they want to see is your thought process. And that's what I'm trying to help lead you through, is identifying what's at stake here and why would you do what you're saying you would do in that situation. They want to see that you've thought through and that you recognize that there are a variety of angles of issues related here. Jennifer W. says, legally speaking, if the family is set on this surgery and you decide to move forward with the procedure, there would be plenty of waivers that would have to be signed off on. No doubt. No doubt indeed that would be the case. Very, very good. This is a difficult situation. It's obviously one that physicians are placed in situations like this on frequent, maybe not frequent, but on a regular basis sometimes, and have to be considered. Xylus, I guess it's Xylus maybe, says, but if there are no, if the patient feels that they should do the surgery, even after many opinions and perspectives given by multiple physicians, then I think it should be done. But if there are no other options, then it should be up to the physician to make the decision based on risk versus benefit. So it's kind of playing each side there. I'm interested that nobody's really commented too much on this cost factor. Who's paying for this surgery? This is the kind of surgery that may cost, hundreds of thousands of dollars to be involved in. And who's going to pay this? If the family's wealthy, obviously they're going to pay for it along with their insurance company. If the family's poor, maybe without insurance, Medicaid would have to step in, or the hospital would eat a lot of the cost. Particularly, public hospitals eat a lot of that cost. So that's good. You guys are really thinking through this really well, and that's really the point. Let's look at scenario number 2 and evaluate what you think we would do with it. So let's look at scenario number 2. Scenario number 2. You are a well-respected general surgeon, and you have known 30-year-old Judy since performing her only abdominal surgery, an emergency appendectomy done 3 years ago. Her primary care physician refers her back to you for evaluation for a possible cholecystectomy, which is essentially removal of the gallbladder. Judy reports some vague abdominal pain. She underwent a sonogram which showed gallstones. You tell Judy that she has gallstones, but you're not certain that those are the source of her pain. Judy agrees to a laparoscopic procedure to remove the gallbladder. However, during the procedure, you notice a sponge, likely left there from her last surgery, and you remove it. The exam reveals no other pathology. By all indications, it appears that she will suffer no significant consequences from the mistake. So the question here is the ethical dilemma for the surgeon. Do you tell Judy about the sponge? Do you tell Judy about the sponge that was likely left in her abdomen during the previous surgery that you completed 3 years before. So what do you think about this question, this ethical dilemma? Do you tell Judy about the sponge? So we have one response: no, I wouldn't. I don't want the hospital to get into trouble. Okay. This is our Langley, Virginia friend. Don't want to tell her, so he does not tell her. What are others of you think? Emily says you absolutely have to communicate this. Errors happen, and this is why you carry insurance. That would be malpractice insurance. Yes, there could be consequences regarding your reputation, but Emily sticks to it. So Trish says, isn't the blatant wrong answer to lie? Good question. Good question. So the question being, is not telling her, it's sort of a lie of omission, I suppose, omitting the fact that you found what you found in the previous surgery. Dana says absolutely should tell her. Madalena says you have to. It's your obligation to tell her. John says I would have to tell her. Unfortunately, mistakes happen in medicine. Anthony says I would involve hospital administrators as well. Good point. In the decision-making process. Now, I can tell you that the hospital attorney is going to have an opinion about this, or the general counsel for the hospital will likely have an opinion about this. Purvis has absolutely informed Judy regarding the sponge removal. During any interaction with the patient, they have the right to know everything that goes on during the procedure. Yeah, this is an issue here of consent. Judy gave her consent to do the surgery originally. She gave her consent to do this cholecystectomy, and the expectation then is that it's going to be done appropriately and cleanly. Pam says yes, you have to be honest and you have to apologize. Vanessa says she has the right to know. Kenyon says yes, you have to. So this is a good point, and some ethicists may say absolutely. What's called a virtue ethicist might argue that the physician is of good character and will strive always to be honest. Honesty is the virtue here. This style of ethics would respond to that in that way, that this is you have to show courage to admit your mistakes and to learn from your mistakes. Obviously, there are others in the surgical suite at the time, and in fact, one of the nurses is supposed to be in charge of, or there will be someone in the surgical suite, someone participating in the surgery, whose job it is to count the number of sponges used, and as they're taken out, to count them again. So this is in this scenario, this would have been a multi-levels of a mistake, both on the part of the surgeon, but also on others in the surgical suite at the time. Other ethicists may have a different point of view on this. Someone who is very utilitarian may argue that the aim is to bring the greatest amount of happiness to all the people involved. Bring the greatest amount of happiness to everyone involved in the process, both the surgeon as well as the patient and the patient's family, perhaps. And so, how is it going to harm Judy if she doesn't know? There's no harm, no foul. Might be a position here. Not telling about the sponge causes less stress for everybody involved. However, there are others in the surgical suite who see that there's a sponge left in here. You can't guarantee necessarily that if you choose not to tell her, that one of one of the others involved in the surgery might not come up and tell her. It may also depend, on what other issues might be involved. Perhaps it might depend somewhat on how well you know Judy. There's a lot of factors here that you may want to consider in this particular ethical scenario. You might want to wait for the pathology report on the gallbladder to see was it the gallbladder? Was there inflammation involved? And was it likely that the pain she was experiencing was from the gallstones, not from the sponge left in her previously? If you determine that, it might lead you to reveal that also and talk to Judy about that. Now, I have a question here. What if Judy's husband is a personal injury attorney in town? How does that change this scenario? What if Judy's husband is a personal injury attorney in town? Does that change how you might think about this scenario, this ethical dilemma, and how you might respond to it? So there were, Kenyon says, I'm confused about there not being gallstones. Yeah, there were gallstones in the gallbladder. So that's the gallbladder was removed. Just not sure if the gallstones were until the pathology report on the gallbladder, you're not going to be sure what was causing the pain that she was experiencing. So let's see. We have several comments here. Pam says you can have gallstones without pain. True. Usually pain comes from an obstruction. This is very true. Mistakes. Trish says mistakes makes what I consider the right thing harder to do. I guess in the case of whether or not the husband was an attorney. Vanessa says I smell big trouble, but she still has to know. I smell big trouble too, Vanessa. I agree with you. Jennifer says it doesn't change anything if he's an attorney. Like you said, this is a multi-level area: scrub tech, scrub nurse, doctor. The entire case, as Emily, needs to be evaluated. The truth always comes out. Now, this is a good question. Do you want, if you don't tell her and somehow it comes out and ends up on the evening news, the local news on the evening, is that what you want? If you're concerned about your reputation as a surgeon and about this mistake, then you have to consider everything decision that you make, that if it's presented on the front page of the newspaper the next day, or the following week, or a month later, or a year later, what will that mean to your reputation that you didn't tell Judy about what had gone on, or what had happened? If you truly saved Julie's life, then they will be more forgiving in the emergency appendectomy. If you saved her life 3 years prior, and you have a good relationship with her, and she's very very happy with the fact that you helped her previously, then it may not be as dire as you anticipate. There may not be a lawsuit or whatever, but in the face of a legal situation, does that change how you approach it in terms of an ethical decision, or perhaps a moral decision on your part? Could affect things very much so. VJ says you should think of the way that you frame it when you tell them. It's not a foul if you tell them really fast and quickly, is it? If you're still telling I think I get what you're saying, BJ. Yeah. I think it's Kawar, I guess maybe it's the name. I would not want the news to come out. I would want the news to come from me, not from the media, she says. Absolutely. Micah says, I would say yes, I would tell the patient because the patient believes she has a condition and act accordingly based on that belief and harm herself trying to treat herself incorrectly, then you're even in more trouble. So let her know. Jake says, I think it's ultimately up to Judy to process and handle the information. Our job should be telling the truth in the most polite manner. But at the end of the day, her response is her own decision. Very, very great response. Great response there, Jake. Jake also says, so I don't think it's wise to avoid telling her entirely, just to avoid one possible response to telling her. Emily says, almost all the patients indicate they desired or expected the physician active knowledge of an error. This ranged from a simple acknowledgement of the error to various forms of apology. I think Jennifer's talking about, perhaps that's Emily talking perhaps about a poll of a patient poll or a survey that had been taken. Absolutely, the truth always comes out, Emily says, always. So this is a good scenario, and I think it represents, again, the opportunity for you to see perhaps that there are multiple angles that have to be considered, but ultimately you make a decision about what is the best. Now, this one's a little bit more straightforward, I think, personally. I think the best way to go is to tell her about but I think what you do in an interview type setting is you acknowledge that different people may view this differently and that there could be different perspectives to be considered in the process of making a decision on this dilemma. So think about that. So let's recap things to remember in terms of MMI preparation. There's no necessarily right answer. They're not looking for the right answer. This is not a black and white exercise for the interviewer that's interviewing you, whether it's MMI or whether it's other types of traditional interviews or not. The MMI stations in particular, as well as I think other types of interviews of this type of nature, where they're presenting some sort of dilemma, ethical dilemma, that they're really focusing not on you getting the right answer or whether or not you're going to understand and come up with the right answer, but they're looking at how are you thinking through this? How are you communicating? Is your ability to communicate strong? Do you have the interpersonal skills that would be? This is what they're looking at in the interview setting in general. Is they've read a lot about you in your application. They've read your personal statement. They've read your letters of recommendation, and what they're looking for is to see: do you have a good thinking process? Do you have a good process of evaluating the dilemma? What are all the issues involved, and then being able to present. Some stations in a interview setting may ask you to argue both sides of an issue. So, for example, in our first ethical dilemma tonight, number one, the sort of glimmer of hope kind of scenario, talking through what would be the benefit of doing the surgery, what would be the benefit of not doing the surgery. What are the costs of doing the surgery? What are the costs of not doing the surgery? What are the issues, the ethical issues involved, whether it's autonomy or beneficence or non-maleficence? And you should know these terms. We're going to talk about some of these terms next week, so you'll want to be around next week as well. So some of these stations, they may ask you to argue both sides of an issue and not really come to a conclusion, but to acknowledge that you understand that there are multiple sides here, and sometimes multiple sides that have a viable options of decision-making process. So this has been a great couple of scenarios, and I think what we're going to do next week is we're going to look even more deeply and carefully at one scenario, and I think you'll really like that. We'll play this scenario out and see what it looks like, and then the following week, let's see, the following week, not next week, so that would be, let's see, what's tonight? This is the 11th, so next week would be the 18th, and then the 25th. So on the 25th of March, we're going to examine we're going to look at a scenario, but we're going to watch it on video. We're going to watch it comes from a movie back from the 1950s, a 1950s movie, and we're going to watch a segment of this movie, and then we're going to evaluate the scenario presented. The name of the movie is The Interns. You've probably never heard of it before. Most people haven't, but it was had quite a starring role of actors in the cast, and but we'll watch part of that movie, and it'll present a scenario to us, and then we'll talk about it. So that'll be fun as well. So glad that you joined us tonight. We're going to end up a little early tonight. Whoops, how did I do that? We're going to end up a little early tonight, but thank you for joining us, and we'll look at more of these ethical situations in the weeks to come. But more so, and I keep repeating this, but I want you to get this in your head. It's about the gray. It's not about the black and white, the right or wrong. It's really about the gray, about evaluating all that there is to delineate an answer that you would feel comfortable with, but acknowledging that there are many perspectives. There are many issues involved, whether it's legal, financial, cultural, social. There could be a lot of different factors involved, and being able to identify those would be really great. So thank you for joining me tonight. Have a good night. It's really great to see you, and we will talk next week on ACE Your MMI Ethics 101. Bye, everybody.